RJL Nigeria for 95.1. Well, let's take the conversation forward. Even now, I'm joined, of course, on the program at this time, Madam Patience Johnson, a world-renowned cosmetic dermatologist, eminent researcher, multi-award-winning international tutor, and author, motivational speaker, beauty industry entrepreneur. She's, of course, the CEO of Derma Contour Worldwide, based in Germany. She's currently consulting at the Derma Contour Aesthetics and Beauty Clinic, Abuja, treating all kinds of skin issues. Madam Patience, thank you so much for coming into the studio this morning.
Good morning.
Yes, in fact, she said to me just some minutes ago now that let's talk about the COVID-19, the coronavirus, and what people need to know about this. It's so very, very important, and I'm glad you decided to take on this very, very serious concern in our public health issue as we have it. Let's start with what people need to know.
They need to know that the virus it spreads as fast as you can imagine. And the best thing is now I'm trying to advise everybody to please go on personal hygiene. It's very, very important. Yeah, now that it's no more you play with any dirt or around the corner, you have to make sure that your environment is very, very clean. You have to wash your hand as often as possible because you don't know who is carrying it. You understand? Because it's not written on the face. So you have to maintain your personal hygiene. Even public hygiene is also important. And then you have to drink lots of water. I've been campaigning on this water drinking. People neglect it. They think only when they are thirsty, they drink. If you're already thirsty before you drink, that means you're already sick. So the best thing is carry water along anywhere you go. Your mouth is not supposed to be dry because this virus nests more on the sebaceous gland. What do I mean? Sebaceous gland is those glands that you have in your mouth, your eyes, your respiratory system, your pubic area, so that it's better you make sure that they are wet, so that anything residing there you can take them down to the stomach, and once you get to the stomach, definitely is going to be excreted. So it's important you increase your water intake. Another thing is a vitamin. When I say vitamin, I don't mean supplement. Go on your raw food, oranges, watermelon. We have lots of them here, so you don't really need to feed yourself on tablets. The raw vitamin will help you. Gargle your mouth with hydrogen peroxide. It's just few drops, not more than 3% hydrogen peroxide, so that you make sure that you don't accumulate anything. It can hang anywhere. So for now, because the way it spreads, we've seen it has already entered Nigeria. And these are the things that we were supposed to be telling people 2 weeks ago, not waiting until it comes and then we start saying, oh, what do we do? What do we do? Because for now, there is no medication for this. I've contacted most of our research centers. Everybody is putting their head together, but you can analyze, you can research on something on a specimen that you know. For now, we don't know this specimen. So everything you're reading on the media or you're seeing is just mere
a trial level.
It's just we are just everybody's just thinking, assumption on assumption, but there's no clear reports of this is how it looks, this is what it means. We have just these three signs, which is the hardness in breathing, and then the coughing and the fever, which other virus infection or even bacterial infection can also. So that is not enough for us to make